My name is Nick Day. I work at the Faculty of Tropical Medicine at Mahidol University, and here I am this evening at the Eastern Grand Hotel in Bangkok, which is the site for the 2023 Jitmm conference. This is the day before the conference begins. We've had a pre-conference workshop on developing diagnostics. It's been organised by the Diagnostic Centre at the Faculty of Tropical Medicine, and we've had some international speakers, some international attendees, both from academia and industry. It's been a very exciting event. A word or two about the Diagnostic Centre. This is an initiative between the Faculty of Tropical Medicine and the Mahidol Oxford Tropical Medicine Research Unit, MORU, to try and boost the development of diagnostic tests from all the hard research, the hard work and excellent research work done by the faculty and by MORU over the years, to try to convert the research into products that can actually be used to help diagnose infectious diseases in this part of the world and other parts of the world too, and therefore have an impact on health via early diagnosis and treatment. So yes, we've had this brilliant workshop. We're now in the post-workshop reception, and people are enjoying themselves, lots of new collaborations being formed. I expect over the next 3 days with Jitmm in full swing that even more new discussions and collaborations will be formed, friendships as well, and I'm really looking forward to the meeting. It's always a good meeting, and I think this year's is shaping up to be a really excellent occasion.
So about the pre-workshop today for the Jitmm, every year we have a Joint International Tropical Medicine meeting. And every year, if possible, we try to have the pre-workshop that also benefit the participants that come from every places, to understand about tropical diseases. This year, the pre-workshop is about global diagnosis for tropical diseases. And why we are interested in this one? Because recently, our Faculty of Tropical Medicine, Mahidol University, just established the new Excellence Center. This Excellence Center will focus on tropical medicine diagnostic. We would like to identify a better or a new diagnostic that can help examine the patient with febrile illness that caused by so many tropical diseases that either they are neglected or we do not have any good diagnostic yet. And the Tropical Medicine Diagnostic Development Center, or TropMedDC for short, has been established by collaboration between the Faculty of Tropical Medicine and Mahidol Oxford Research Unit from Oxford. Okay, the funding comes from both Thai government and also the Oxford, which usually from the special program from Wellcome Trust. The workshop today is a kind like meet together on networking between academic partner and the private sector that also interested or already developed so many diagnostic for tropical diseases. So at the academia, I think we have learned a lot on how the private sector is looking for the new diagnostic. And at the same time, I think this is an opportunity for many private companies that are interested in developing the new diagnostic, because to validate the diagnostic, they need the clinical sample from the real patient, from endemic population. So I think all of us have learned a lot, and I am as executive director of the new TropMedDC. So I'm very happy with the outcome, and we are sure that we're going to expand our network, and we may have this type of workshop again in the future. Thank you.
I like the event a lot. So I learned what are the market expectations, what all the researchers and the community is doing in the field of the tropical medicine. I learned a lot about the disease diagnostics. The organization was really good, and I loved interacting with all the key opinion leaders, the experts, and the community here. And we also figured out like how we can support the community in a big way from the FEP side. And I'm looking forward like to interact more in the coming days. Thank you.
It's wonderful to be here for another year at Jitmm. So far on day one, it's been another high quality day. The focus on looking at how we might better work with commercial entities, with manufacturers on the development of point of care tests for tropical diseases is essential. We've learned a lot today, and I'm looking forward to the rest of the talks this afternoon.
Hello, my name is Kavita, and I'm the Translational Research Manager from Translation Research Office from the University of Oxford. It's a pleasure to be here today, attending the JITM pre-meeting workshop. It's fantastic to see how much research is being done in tropical diseases, not just the more common one, but also the neglected diseases. How much further and far has platform technologies and diagnostic devices in vitro has come forward in LMIC countries in Southeast Asia, Asia, and African countries in general. The vibe here is very, very good and very collaborative. There's various different attendees, ranging from researchers as well as industry players, where we have learned a lot from on what the gaps are in translational science and what is to be expected for in the next 5 years. Thank you.
First of all, I'm very happy to be here because it's my first time in Thailand. Very far away from Senegal, but enjoying it so far. The GITMM conference is the first attendance for me. It's very interesting because I can see it's very pluridisciplinary. You have people from the lab, you have people from private companies, and people like me coming from foundation that are trying really to take the R&D from the lab to the market. So I can see that many of the challenges that we are facing in Africa are also the same challenges that people may face here in Thailand, and this has been emphasized by the other big private companies. So now my main goal is really to see how we can learn, how I can learn better from what have been said here, because I think that will be very useful for when I will return in Senegal. Also, I can see very many synergies between what we are doing in Senegal, also what people are trying to do here in Thailand, but also in Indonesia. I think there is a lot to learn if we are willing to build networks and share opportunities and challenges in order to strengthen the local manufacturing of diagnostics for NTDs, but not only for NTDs, but also for newly emerging diseases that has not been yet classified like NTDs, because that will help us be better prepared for the next epidemic or for the next big pandemic.
It's been very helpful to attend this meeting, so to bring sort of what we do in Oxford to a sort of more international perspective. So really enjoyed engaging with the other members of the unit in Morrow here, but also more broadly with the diagnostics industry of the region. So it's quite interesting for us because I think that many of the diagnostics that can be developed within the developing world have great applicability within the primary care settings that we work in Oxford as well. So it's been a really good opportunity to network, and I'm looking forward to the next couple of days at the conference.
Hi, my name is Maytouch. I'm a project consultant for the TropMed DC, and I'm also part of the main teams for organizing this event, the pre-meeting workshop JITMM 2023. We as organizing teams has been really working hard on making sure that all our participants are enjoying the show, having a great smooth time and productive conversations about how to carry on and improve the diagnostic field development globally. And as part of the development teams, I have also seen a really good result with the productive conversations being made, a really casual conversation at the dinner, and also a really productive exchange of knowledge during the meeting expert sessions that I have hosted. And to carry on further projects, we have made sure that there will be continuous follow-up and making sure that all these match has been made. All our team has worked really hard to make this happen, and really proud of the product that we have made, the productive sessions, all the time that we have put in. It has all been fruitful, and we are really proud of that. We also have recruited a lot of important participants and speakers who have given a lot of insights from Oxford University's industrial partner from China, Indonesia, as well as the Quaijin's could join us. And so we want to continuously working hard to make these kind of events happen. We want to make sure that there's more productive conversations that would lead to new development of diagnostic tools that would help to save more lives, helps to solve problems in the real world, and eventually just put more productive members of society as our researchers who is really talented and knowledgeable to create something innovative to save more lives, not just in Thailand, but everywhere around the world. As the representative of the TropMed DC, I would like to thank all the participants, and if we were to ever make any kind of future events like this, we will be welcoming you to join us in the future.